All right, folks, as you may or may not have heard by now, we have some urgent breaking news regarding another disastrous series of decisions by the Trump administration, which could have massive implication for the health of millions of Americans, not just now, but in the future. Take a look.
The big question at one of America's most vital public health institutions this morning: who's in charge? CDC Director Susan Manaras has been fired less than a month after she was sworn in. The White House says Manaras is not aligned with the president's agenda of making America healthy again. Her lawyers accuse Health and Human Services Secretary Robert F. Kennedy Jr. of, quote, weaponizing public health for political gain and putting millions of American lives at risk. A person familiar with the situation tells CNN that she clashed with Kennedy over vaccine policies and also his plans to share research that could draw links between immunizations and autism. Here's Manaras at her confirmation hearing just 2 months ago.
Vaccines absolutely save lives. And if I'm confirmed as a CDC director, I commit to making sure that we continue to prioritize vaccine availability. The FDA has, in the production of the COVID-19 vaccine, had approved the mRNA vaccines as safe and had demonstrated efficacy associated with them.
3 other top CDC officials are also out after raising the same concerns on vaccines. Joining me now in the group chat, Betsy Klein, senior White House reporter, Soshi Hinojosa, former Justice Department official, and Mike Dubke, former Trump White House communications director. So, Betsy, since this is kind of out of the Trump administration, out of the White House, can you talk to me about this clash? In the hearings, she spoke highly of Trump. She talked about her ability to follow the kind of typical protocols that are medically recommended. So why did this fall apart?
I think ultimately it was a clash between her and Robert F. Kennedy Jr. over this issue of a number of staffers that he wanted her to let go. And because he didn't agree with them on a number of issues like vaccines, like HIV prevention, other topics, and she stood up for them, we are told in one of those meetings, and it just wasn't able to, she wasn't able to break through.
All right, so we're going to look into a New York Times deep dive on this because a lot's happened since the story originally broke. But again, I cannot stress enough how deleterious this is for your health, the health of your friends, family, and loved ones in future generations as a consequence of RFK Jr.'s appointment to Health and Human Services Secretary. As a matter of fact, Bill Cassidy is a name I want you guys to remember because he is a Republican senator from Louisiana. He's a physician. He's a doctor. And in many ways, he was the decisive vote confirming RFK Jr. He had misgivings about RFK Jr., but was successfully pressured by Trump, despite his misgivings, into confirming RFK Jr. Well, he's publicly freaking out now because he put his ass and his reputation on the line as a physician to confirm this kook. And now it's backfiring. It's continuing to backfire. I want you all to remember that because that man deserves nothing but your eternal contempt for endangering the lives of so many people. But let's take a look. CDC standoff. Kennedy's push to fire director devolves into chaos. Lawyers for the agency's chief, Susan Manaras, insist that the impasse with Health and Human Services Secretary RFK Jr. can only be resolved by Donald Trump. The CDC dissolved into further turmoil on Thursday when guards escorted 3 top officials from the agency's Atlanta headquarters during the continuing standoff with the Trump administration over whether the CDC director would keep her job. The high-ranking officials decided to quit as RFK Jr. was demanding that the CDC director resign or be fired in a dispute largely over vaccine policy. The White House said late Wednesday that Dr. Manaras, an infectious disease researcher who was sworn in less than a month ago, appointed by the Trump administration, had been dismissed. But her lawyers, who said she had chosen, quote, protecting the public over serving a political agenda, insisted she remain CDC director until Donald Trump fired her personally. The dispute now appears to be in the hands of Trump, who has not weighed in publicly. A spokesperson for the White House did not respond to inquiry about whether the president could fire Dr. Manaras. Appearing on Fox News on Thursday morning, RFK Jr. criticized the CDC, quote, the agency is in trouble, and we need to fix it, and we are fixing it, and it may be that some people should not be working there anymore. With Dr. Manaras facing an uncertain future at best and the agency's top ranks depleted, leading public experts wondered aloud Thursday whether the CDC could recover and what might happen should a pandemic or other health crises arise. Quote, as bad as things have been since January, the firing of thousands of federal health workers, extreme budget cuts, the ongoing assault on our nation's vaccination system, and what we saw yesterday was another level entirely. an extraordinary and systematic dismantling of the very top of our nation's public health system, said Dr. Richard Besser, a former acting director of the agency. In Washington, senators from both parties expressed dismay at the events unfolding at the CDC. The Republican-led Senate voted only last month to confirm Dr. Menarez. She's the first CDC director to be subject to Senate confirmation. As such, she works at the pleasure of the president, not RFK Jr. This is where Bill Cassidy comes into play again. Just a truly spineless, despicable piece of shit. That's me, not the New York Times, saying that. The chairman of the Senate Health Committee, Bill Cassidy, a Louisiana Republican and physician who only voted for Kennedy after publicly agonizing over it, said on social media late Wednesday that the, quote, high-profile departures will require oversight by his panel. He did not elaborate, and his spokesperson did not respond to requests for comment. Senator Bernie Sanders, the Vermont independent and ranking member of the panel, called for a hearing with RFK Jr. and Dr. Menarez and said the attempt to fire her was outrageous. Senator Patty Murray, Democrat of Washington and former chairwoman of the committee, called for RFK's, quote, immediate termination. The three officials who were ushered out the door by security on Thursday had resigned en masse. CDC employees had planned to gather at agency headquarters in Atlanta at 2:45 p.m. for a clap-out send-off to honor them, but they were rushed out before it could happen. The officials had decades of government experience and all influenced vaccine policy. Dr. Deborah Horry, the CDC's chief medical officer, coordinated the various arms of the agency. Dr. Dimitri Daskalakis ran the center that oversees respiratory illnesses and issues vaccine recommendations. Dr. Daniel Jernigan supervised the center that oversees emerging diseases and vaccine safety. A fourth official, Dr. Jennifer Layden, who resigned a day earlier, led the Office of Public Health Data. Morale at the CDC has plummeted in recent months, with employees buffeted by mass layoffs and deep cuts in funding and core functions. And the agency and its employees are still reeling from a deadly shooting at its Atlanta headquarters in early August. A gunman fired hundreds of rounds at the building during work hours, killing a police officer, shattering windows, and terrifying employees. According to people familiar with the events, the relationship between RFK Jr. and Dr. Menarez, an infectious disease researcher and a government scientist who's worked for administrations of both parties for 20 years, splintered over vaccine policy. So, let's take a look here. Adam Cankren says, where we're at, HHS says it's ousted the CDC director. CDC director says she's not been fired and isn't leaving. In the meantime, at least 4 senior officials have resigned. This is all happening only a month after RFK's handpicked, now ousted, CDC director was confirmed. This is from a physician. This clip is going viral. This tweet is going viral on Twitter. Susan Menarez is a career scientist with a history of integrity and evidence-based leadership. She was confirmed as CDC director less than a month ago, and RFK Jr. has already forced her out, not because she failed the job, but because she follows the science, not the grift. His, quote, radical transparency is a sham. This is about control, not truth. Step out of line, and you're gone. This is the Dr. Dimitri I'm blanking on his last name. I'm going to butcher his last name. I just referenced him in the article. Daskalakis, who was one of the 4 top-ranking officials who resigned. This is his resignation letter. It says, I'm writing to formally resign my position as the director of National Center for Immunization and Respiratory Diseases at the Center for Disease Control and Prevention. The decision has not come easily, as I deeply value the work that the CDC does in safeguarding public health, and I'm proud of my contributions to that critical mission. However, after much contemplation and reflection on recent developments and perspectives brought in light by RFK Jr., I find the views of he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people. Enough is enough. I am unable to serve in an environment that treats the CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than improve the public's health. The recent change in the adult and children's immunization schedule threatens the lives of the youngest Americans and pregnant people. The data analyses that supported this decisions have never been shared with the CDC, despite my respectful requests to HHS and other leadership. This lack of meaningful engagement was further compounded by, quote, frequently asked questions document written to support the Secretary's directive that was circulated by HHS without input from the CDC subject matter experts and that cited studies that did not support the conclusions that were attributed to those authors. Having worked in local and national public health for years, I have never experienced such radical non-transparency, nor have I ever seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. It's untenable to serve in an organization that is not afforded the opportunity to discuss decisions of scientific and public health importance released under the moniker of CDC. The lack of communication by HHS and other CDC political leadership that culminates in social media posts announcing major policy changes without prior notice demonstrate a disregard of normal communication channels and common sense. Having to retrofit analyses and policy actions to match inadequately thought out announcements in poorly scripted videos or page-long X posts should not be how organizations responsible for the health of people should function. Some examples include the announcement of the change in the COVID-19 recommendations for children and pregnant people, the firing of scientists from ACIP by X post, and an op-ed rather than direct communication with these valuable experts. The announcement of new ACIP members by X before onboarding and vetting have been completed, and the release of term of reference for an ACIP program workgroup, that ignored all feedback from career staff at the CDC. The recent term of reference for COVID vaccine work group created by the ACIP puts people of dubious intent and more dubious scientific rigor in charge of recommending vaccine policy to a director hamstrung and sidelined by an authoritarian leader. The desire to please a political base will result in death and disability of vulnerable children and adults. Their base should be the people they serve, not a political voting bloc. I've always been the first to challenge scientific and public health dogma in my career and was excited by the opportunity to do so again. I was optimistic that there'd be an opportunity to brief the secretary about key topics such as measles, avian influenza, and the highly coordinated approach to respiratory virus season. Such briefings would allow the exchange of ideas and a shared path to support the vision of making America healthy again. We're 7 months into the new administration, and no CDC subject matter expert from my center has ever briefed the secretary. I'm not sure who the secretary is listening to, but it's quite certainly not to us. Unvetted and conflicted outside organizations seem to be the sources HHS use over the gold standard science of the CDC and other reputable sources. At a hearing, RFK Jr. said Americans should not take medical advice from him. To the contrary, an appropriately briefed and inquisitive secretary should be a source of health information for the people he serves. As it stands now, I must agree with him that he should not be considered a source of accurate information. Ouch. The intentional eroding of low-risk vaccines favoring natural infection and unproven remedies will bring us to a pre-vaccine era where only the strong will survive and many, if not all, will suffer. I believe in nutrition and exercise. I believe in making our food supply healthier, and I also believe in using vaccines to prevent death and disability. Eugenics plays prominently in the rhetoric being generated and is derivative of a legacy that good medicine and science should continue to shun. The recent shooting at the CDC is not while I'm resigning. My grandfather, who I am named after, stood up to fascist forces in Greece and lost his life in doing so. I'm resigning to make him and his legacy proud. I'm resigning because the cowardice of a leader that cannot admit that his and his minions' words over decades created an environment where violence like this can occur. I reject his and his colleagues' thoughts and prayers and advise that they direct those to people that they have not actively harmed. And it goes on like this. This is just, folks, this is not good news. It's just not good news. It's just not good news. I don't know what to say, despite Joe Scarborough, conservative, former Republican congressman, he now hosts Morning Joe. The recklessness of RFK Jr. knows no bounds. Republicans knew better. Senator Cassidy knew better. They turned a blind eye to his malevolent movement and the suffering it will cause children for years to come. The indictment breaking, Bill Cassidy is calling for the CDC's vaccine advisors meeting to be postponed. Quote, if the meeting proceeds, any recommendations made should be rejected as lacking legitimacy given the seriousness of the allegations and the current turmoil within CDC leadership. So, simply say this because we usually don't cover public health here, but we probably should, given that it's become a policy issue, particularly in the Trump administration. The lives of you and your loved ones and your children and your children's children and your children's children's children are now in more danger as a consequence of Donald Trump and RFK Jr. and their anti-science, pseudoscience approach. Remember, the person that they fired was a Trump-appointed, Senate-confirmed, and Senate being controlled by Trump's party, the Republican person who was just confirmed less than a month ago. But that is how relentlessly anti-science RFK Jr. is, that he can't even work with her. So this is serious shit. You should definitely look into it. And again, remember who to blame for this. Trump, RFK Jr., Bill Cassidy in particular, and the Republican Party in general for making this shit happen. In the meantime, let me know what you think in the comments.